Okay, so we're going to talk now about reproductive health for children and adolescents. One of the things that you really need to do some self-reflecting and spend some time on is figuring out what your own values and beliefs are, because reproductive health, which is a lot of this semester, is going to be one of the places where those are challenged the most frequently. So you really need to understand what your belief system is and what you can do within that belief system, and be able to separate that from imposing the belief system on others. Okay, so one of the areas where that comes into play is sex education. Like I mentioned before, my kids' high school has an abstinence poster on the girls' bathroom door. Last time I checked, it was still there. None of my kids has had any sex education at all in their school years. When I was in high school, they skipped the reproductive chapter in biology. It was just kind of like, don't think about these things, okay? And we still kind of operate on that assumption that if kids don't know about the mechanics, they won't figure it out on their own. That's inaccurate. Kids who have comprehensive sex education, and that includes contraception and STI prevention, not only do they have lower pregnancy rates, lower STI rates, but they tend to wait longer to become sexually active, because that education takes away some of the mystery and some of the don't do this piece, but also helps them understand some of the potential consequences. So kids with comprehensive sex education tend to wait longer. Okay, research has shown that. So what do we want to recommend that parents do? Obviously, parents have the right to make decisions about their children's education. At some point, that may involve the parent needing to take control of their child's education and homeschool if what they want from that education is different enough from what's happening in the school. So we want to encourage parents to answer questions when kids are young, to make age-appropriate information available to kids throughout the lifespan, rather than, oh, let's wait till later, you're not old enough, and have a big talk at 14 that's all awkward and it's way too late anyway. We want to make information available to kids that's age appropriate through the lifespan. So a 3-year-old may start noticing differences in between boys and girls. And rather than, oh, we've got to, distract from that, acknowledge those differences. And as they get older, kids begin to become curious about other things. So make age appropriate information available. There have been organized sex education programs in place in some places for a really long time. And at first they were about the mechanics, and then different things have been added in at different times. There have been a lot of controversies about that, but something that was largely missing until the last few years was integrating that with relationship education. And there are some really good programs out there now that talk about healthy relationships and setting boundaries and respecting the boundaries of other people. And that can then move into consent, and that can then move into avoiding unhealthy or abusive relationships. So there's some really good programs that combine those things. They often start young, and they don't start with the mechanics of sex in 2nd grade. They start with how we treat people, and what do I do if someone is trying to make me do something I don't want to do? What do I do if someone's trying to make me play a game I don't want to play? And so those things about learning boundaries then translate into sex education later on. So there's some great programs out there now. Pretty sure Choctaw Nation still has one. I know that they have partnered with some schools in this area and had some really good results. Hygiene education. What do we teach girls, children, adolescents about hygiene? We want them to wipe from front to back. We recommend that people avoid scented and dyed products, especially if they're sensitive to them. And then we want them to avoid douching. We want to recommend that people avoid harsh products, soaps, detergents, things like that on mucous membrane. Mucous membrane can be cleaned with water or with gentle cleansers that are intended for that purpose, but be careful about scents, dyes, soaps, things like that. Okay. How to manage menstruation. You're familiar with pads. If you're not, it's pretty self-explanatory. They're adhesive. They stick in underwear. Some people prefer them. Some people find them bulky and uncomfortable. So I'm going to show a couple of other things. Most of you are probably also familiar with tampons, but I'm going to show a couple of other images. Tampons have, this is an insertion diagram. It's showing that you should insert parallel, not perpendicular, to follow the track of the vagina. Tampons are cotton. They have a string for removal. Most of them have either a plastic or a cardboard applicator for insertion. There are some brands that now don't have applicators for insertion. Tampons, once they're in place, should not be uncomfortable. If they are, then it may be the wrong size, or the flow may not be heavy enough to use a tampon. One of the risks is that if that cotton is not completely saturated, it adheres to the wall of the vagina. And so then when it's removed, it causes small tears that can be a focus of infection. So we want to make sure that people are not using tampons that are too absorbent for their needs. The super absorbent tampons are not recommended anyway because of risk of toxic shock. And we want to make sure that they're not using them for normal secretions, just for menstruation. So now let's look at a couple of menstrual cups. So another way that has come around more recently, menstrual cups are actually really old. They were used in the early 20th century, but then no one used them for a really long time. And then they came back in, I think maybe the 90s. And at first they were just kind of a hippie thing. Now they're becoming more popular. So you need to be familiar with them because you may run into a patient in some kind of emergency situation who's used one, and you need to know what you see. So this is called the soft cup, the Instead soft cup. These are inserted. These are disposable. They're meant for one-time use. The rim is flexible and it's inserted up around the cervix. Okay, so these are inserted pretty high. On one of the other diagrams in a minute, I'll show you where it would be sitting. Okay, these are meant to be single-time use. When it's filled, it's removed and discarded. This is a reusable menstrual cup. It has a stem for removal. These are also very flexible. That can be folded and then they're inserted and moved to unfold them. And then they can be removed, emptied, cleaned, and replaced. And let's look at where one of those sits. Okay, so this is where the reusable menstrual cup sits. It's down in the lower part of the vagina. Okay. The disposable ones sit up around the cervix, up higher. So with those, if you have an IUD, there's a greater risk of dislodging that IUD. There's also there's potentially greater risk of infection because it's sitting right there around the cervix. Okay. So a lot of women are beginning to use cups because they can be left in place longer than tampons safely. And they may be less messy than pads, or feel less messy than pads. A reusable cup can actually be left in place for 12 hours unless someone has very heavy flow. And then it's removed, cleaned, and replaced every 12 hours. Okay. Entering gynecologic care. So there's some controversy not controversy, there's some disagreement about when to begin pap smears. The main reason most people go to the gynecologist, to begin with is usually for birth control. But one of the major reasons we go to gynecology is for cervical cancer screening. PAP stands for Papinocolau. I hope I said that right. It's probably didn't. But we talk about pap smears. It is a sample of cervical tissue that is examined for the presence of cancerous tissue or tissue that has had changes. They should begin at 21 years or 3 years after beginning sexual activity, whichever is earlier. Okay, so by 21, no matter what, if it's before 21, it's 3 years after beginning sexual activity. Contraception and STI prevention and treatment is another reason to seek gynecologic care. You need to be aware that in most states, girls from around 12 years and older, and those ages vary from state to state, but most of them around 12, are considered emancipated for reproductive health purposes. That means they do not require parental consent to seek care for contraception, for STI testing and treatment, for pregnancy. Okay. The HPV vaccine is offered to late preteens around 11. Women who've been vaccinated for HPV should be screened at the same schedule as everyone else. It's not a get out of jail free card. It does drastically decrease the risk of cervical cancer, but they still need the same screenings as everyone else. Another thing to know and to let the people of your acquaintance know is that the internal exam is not required to obtain contraception. So sometimes people are afraid to go and get birth control because they're afraid they'll have to have an internal exam, and that's not required. Some stats about teen sexual activity and pregnancy. These are from 2015. It's been hard to get more recent stats because for a while they weren't being kept, and then a lot of public health right now is devoted to COVID, so it's hard to find recent stats. But by age 18, in 2015, by age 18, 55% of teenagers had had sex by age 18. That has decreased since the 1980s. 80% of teenagers use contraception the first time they have sex, and effective sex and family life education reduces teen pregnancy rates. So we kind of think of kids as just running around having sex with everybody. That's really not what's happening. With greater education, teenagers have actually become much more thoughtful about their sexuality. So I want to talk about a few health issues that are common to women in this age group, or to children and adolescents. Menstrual problems are very common in adolescents. Once the hormones begin to regulate and they begin to ovulate and menstruate regularly, then dysmenorrhea and other menstrual problems are fairly common. Vaginitis is not uncommon, but there is a piece of that is about lack of knowledge. Discharge from the vagina is normal through the menstrual cycle. There are different types of discharge that are normal. And there are quite a few people who have come to believe that any discharge is problematic or means signals an infection or signals poor hygiene. And so some piece of that is education as well. And we're going to talk about those those issues in a little while. Children and adolescents are also at risk for eating disorders, for mental health disorders, for chemical abuse, and for relationship violence. When we talk about relationship violence, coming up in a lecture very soon, one of the things that we know is it doesn't start in adulthood, it starts in adolescence. So those are some things to be aware of for this particular group. We're going to talk about specific reproductive health problems at the end. All right, so the next recording will be about younger and middle-aged women.